The idea with hysteria was that the olden people in olden days used to think that the uterus is a weird organ that just,
walks around the body.
Gets wanderlust every now and then. It's like, आज हम दिमाग में जाएंगे, and that's why women get headaches. आज हम दिल में जाएंगे, that's why women get anxiety.
Everything was blamed on the uterus.
Everything was blamed on the uterus. Did you know that 40% of all pregnancies are unplanned? सोच में पड़ गए? बेहतरीन. That's kind of the point of this podcast. We want to make you think. Think about science, think about the world, and most importantly, think about your body. And to give you the correct answers and to make you laugh, we bring on experts. And today we have with us Dr. Deepti. Dr. Deepti, or Dr. Wombastic as she's known on Instagram, is a Goa-based OB/GYN, and she makes great content about periods, sexual health, reproductive health, puberty, pregnancy, and all of the questions you have always wanted to ask about your body, especially in regards to fertility. Thank you so much. So, when was the first time you went to a gynecologist?
So I went to a gynecologist when I was in MBBS, and I had this terrible yeast infection, and I was terrified of going because I knew they would assume that I was sexually active, because I know how gynecologists think now, having been in MBBS for so many years.
Yeah.
But then I had to go because I had to get, myself sorted out because it was painful. It was not a good experience, because I could see them, assuming things that weren't true, which is sad, but then that's how some of them are. So,
did you get shamed in any way?
There wasn't anything said, but then, there was the whole assumption and the atmosphere. You can tell when somebody is judging you, right?
Yeah.
You can tell, yeah. And there are these subtle questions that are not, you know what I'm saying?
Not necessary.
Yeah, that are not necessary at all, yeah.
So, if somebody's never been to a gynecologist, ever. For example, I have never been to a gynecologist simply because my gynecologist is my mother. So if somebody's never been, other than, these barriers, of course, what do you think they should keep in mind when they're going to the gynecologist for the first time? Is it meant to be a scary experience? What are the things they should care about? As a gynecologist too, and somebody who deals with a lot of young people.
I think, first of all, they should go in and when they meet their gynecologist, the vibe should be right. You should trust your gynecologist, because if you're going to keep things from your gynecologist, there's no point in you going.
Yeah.
Might as well not go.
Yeah.
Right? So you need to go to someone that you trust completely, and you need to be completely truthful with them, because you need to know that the questions they're asking you is not to shame you, but to genuinely help you. Because I need to know if you're sexually active so that I can do a certain test or not do a certain test or have a certain diagnosis in mind. So if you feel at all awkward or shamed or anything, just change your gynecologist, but you don't have to stick to somebody that you're not comfortable with. It's not going to help you in any way. It's
very funny you mentioned that, because that particular sexually active question, it tends to raise a lot of questions for a lot of people.
That's why people don't even ask you if you're sexually active. They're like, Are you married? Like, what does that mean? I've had patients who've been married for like 3 years and are not sexually active. Hello. It's not like, if you're married, you're sexually active. I wish people would just ask what they mean to ask,
So I find that quite interesting, because working in where I work in Allahabad and doing medical school in Meerut, I've grown up in a very conservative part of the country. And I know for a fact, if I asked anybody, are you sexually active? चप्पल लेके मारेंगे मुझे वहीं पे. Not just them, but their relatives will get very cross with me. If I ask an unmarried woman, are you sexually active? She will feel like I'm attacking her in some way. So I feel like for a lot of us, it's a very difficult balance to strike. Like, how do you figure out कि इनसे sexually active पूछना है कि married पूछना है? Because then automatically you're stereotyping people. If they look a certain way, you'll be like, oh, I'll ask her if she's married. Or if she looks a certain way, I'll ask her if she's sexually active. If she speaks a certain way, which is very classist.
Yeah. It's a very fine line, but I tend to stick to are you sexually active? And like the feeling awkward with their relative there, I tend to ask the relative to leave.
Yeah.
And I make it more one-on-one. And then I ask them, because there's this thing in India of everybody coming with their mothers and then, or their, some relative. And then they're not completely honest with you. But then you have to ask that question, Tanya, because if you don't, then you're going to miss certain things, which you don't want to. So it's a question we have to ask. So don't take it personally, is all I can say.
Do you want to talk a little bit about why it's important to ask that question? Why is it so important that we do know somebody's sexual history before we go in for a gynecological, even just like a healthcare consultation?
The infections that you can have vaginally, not all vaginal infections are sexually transmitted. So if someone tells me for a fact that they're not sexually active, there are certain things that I can rule out completely. And there are certain things I can diagnose her with. If someone tells me that they've missed their period and they're not sexually active, then it's a completely different scenario.
Yeah.
If they're sexually active, I don't want to do a pregnancy test behind somebody's back. I mean, it's a violation of somebody's rights.
Yeah. No, but I know the kind of...
But at the same time, if you miss something...
the kind of jhamp you'd get from your professors if you miss that.
Yeah.
And you say, "Arey nahi, patient ne to ye bola tha," they'll be like, oh.
It's happened. And you've had patients with something like an ectopic pregnancy, which is outside the uterus. And then, that's a life-threatening condition.
Yeah.
And as a doctor, that's something that you can't miss.
And unfortunately, I mean, this is really sad, but in so many cases of sexual assault, young people don't know they've been assaulted. They don't know what's happened and they end up pregnant. There's no way you can ask them, are you sexually active, if they're a very young person? And then suddenly you find out they're pregnant. There's so much nuance in this question. And I know why people get angry about it, but I also feel like there's also so much context to why we phrase it the way we phrase it.
Very true. So this is why I keep saying that the change has to come right from parents. If they start talking to their kids with the proper terminology, with the proper language, you have to prime your kids and tell them certain things about being sexually assaulted. No one's supposed to touch you there. You're not supposed to touch somebody over there. Nobody's supposed to show you. There are a set of questions.
Yeah.
Even simple things like, don't let anybody take pictures of you. Don't let anybody show you naked pictures. Things that you don't think of. But I think every parent needs to be educated on this so that they can pass this on to their children. And then at least that awareness is there. Because I have so many patients who come to me at the age of 30 and, they have something like vaginismus. And then you probe. And they're like, oh my God, I was sexually assaulted and I didn't even know it until this moment. Sad.
Actually, since you did mention vaginismus, I do want to talk a little bit about that because most of us don't quite know what it is. I went through most of medical school not knowing what it is, and then I saw some TV show and I was like, ye kya hai? Ye to bada interesting lag raha hai. Because somebody had compared the vagina to a Venus flytrap. And it made my whole day. So I went and read about it and then I learned more and more about it. So for people who don't know, what is vaginismus from a gynecological perspective?
So there are these muscles in your pelvis that you can't see. Now, if I tell you to flex your biceps, I'll be able to see that you're flexing your biceps. But if there are these muscles around the vagina that are really strong, that are surprisingly strong, and they can shut your vagina like a trapdoor,
like
just
a Venus flytrap.
like completely, like just shut. And nothing you do can force that door open. And a lot of times this is very subconscious, like the woman doesn't even know that she's doing it, So that's what vaginismus is, where putting anything into the vagina seems impossible, even a tampon, a finger, a penis. So, I mean, most of the time, like I said, they don't even know that they're doing it. It just happens,
Involuntary, completely.
Involuntary, yeah.
So, what sort of treatment options can people with vaginismus ever have children? Because, certain degree of penetration is involved.
I had this beautiful success story where somebody came to me with vaginismus and she hadn't consummated a marriage. And we worked through it. So, you rule out all the other things like a thicker than usual hymen, an infection, and then you get to the root of the vaginismus and you help them relax those muscles, strain those muscles. There's a whole process to it. She not only got pregnant, but she had a vaginal delivery, which was amazing. And she was so happy. I was so happy. It was just like, it was the best. It was the best feeling.
It.
Yeah.
It's stuff like this that makes me get out of bed in the morning.
For sure. Yeah. Yeah.
Genuinely, it makes your whole, like, you will recount this story for the next 30 years. And it will be that, that motivational force in your life. It's so wonderful.
This is one of the jewels in my crown. I'm telling you. I love it.
I love it. Wonderful. So, since we're talking about putting things in things, one thing that a lot of people don't know that you're supposed to put in there once you're sexually active is a speculum, because a pap smear is quite important. Unfortunately, and even I lack in this, I've never talked about a pap smear on my page, and I feel like we don't do enough to raise awareness about the importance of pap smears. Before I say pap smear for the 50th time in the same sentence, I'm going to ask you, what is a pap smear?
So, cervical cancer is one of the cancers that we know what causes it. 99% of cervical cancers are caused by this virus called HPV. Now, most of us, when we start getting sexually active, are going to get HPV. It doesn't matter if you're in a monogamous relationship. It doesn't matter if you have multiple partners.
Wonderful point. Thank you.
Yeah, so most people will get HPV, like about, I think, 80% of us. But also most of us will clear it with our own immunity. Now, it's very difficult to predict who's going to clear it, who's not going to clear it. And for those of us who don't clear it, it kind of integrates into our cells, just like HIV does, and it starts causing changes in the DNA around the cervical cells, and it causes cancer. Now, the silver lining in all of this is it doesn't cause cancer right away. It causes cancer over a period of 10 to 15 years. And in that time, you have like pre-cancerous changes. So if you do pap smears every couple of years, which is where you take a little brush, you put in a speculum into the vagina, which is to open up. It's a little instrument to open up the vagina. Then you take
like a duck bill.
Yeah, it looks exactly like that. Yeah. Then you take a brush, you brush some cells of the cervix, just like you would do a DNA test, brush some cells of your cheek and send it for a genetic test. It's the same thing. It's completely painless because these cells are already dead and they're just being brushed off. And you send it to the lab, and then we pick up changes, precancerous changes, and we treat it before you ever get to cancer. I mean, if you lived in the UK, you'd get an invitation, right? Every couple of years from the NHS saying, please come for your pap smear, please come. But here, somehow HPV seems to be linked to promiscuity. Promiscuity, more than, it's a stupid association, and it's preventing people from getting the healthcare that they need.
I remember reading this in my gynae textbook, that the risk factors for cervical cancer, and one of the things was sexual promiscuity. And I feel like it's things like this that changed the things I feel passionate about. It made me so angry.
Yeah, very true.
And it made me so angry, and it sort of became a defining...
And when you attach shame to certain diagnoses, then nobody wants to talk about it, Yeah. And then you feel like you're the only person in the world who's ever had HPV, because you think that nobody else has it, because I'm so sexually promiscuous that it's ridiculous. It takes away from the conversation.
Absolutely. And do you also feel that, I personally feel this a lot, that women's healthcare issues tend to have more shame attached to it, even if it's not sexual in nature? If it's anything to do with women's health, so often it will be attached to some sort of shame or some sort of stigma.
I mean, the word hysterectomy comes from hysteria. So that's what, people think. If women complain about something, they're probably exaggerating, or they're not really feeling what they're feeling, or they're emotionally labile, or maybe it's their hormones. Women aren't taken seriously.
Yeah. I think there's a lot of good data on how physicians are less likely to recognize or pay notice to women's pains, which I feel ties in very interestingly to your complaint during your pregnancy.
Yeah, it was crazy. Yeah.
Do you want to talk about that?
Yeah, so when I was pregnant, about my last month of pregnancy, I started having this weird abdominal pain, and it wouldn't go away. And everybody told me, they did a basic exam, and they said, maybe it's nothing. It's probably in your head. It's nothing much. Blah blah blah. I went into labor. I had my epidural. The contractions went away, but I still had this persistent pain on my right side, which was this weird burning pain that wouldn't go away. Nothing happened. I had my cesarean. After my cesarean, I kept having pain. For 6 weeks, I had pain. For 6 weeks, I had fever.
And a gynecologist at that.
Yeah. And everybody told you, you just had a Caesar, maybe it's related to that. But it turns out I had appendicitis. It wasn't picked up. My appendix burst. It wasn't picked up. My appendix formed an abscess, and then one day I collapsed, and that's when they picked it up and they did the surgery. And it's funny because if you look at appendicular abscess on Wikipedia or on Google, it is a disease seen in poverty, in people who have no access to healthcare. It's a life-threatening condition, and it could have been completely avoided. And the funny thing is, even as a doctor, but I got completely convinced that they were right. And I was like a fusspot, and I was just imagining all of this pain, and I had no tolerance to pain. It was like gaslighting in a way.
Medical gaslighting, absolutely. And it happens so often with women, which I find really, really interesting, because if you go back to the word hystera means uterus. And, hysteria is uterus ka problem. The idea with hysteria was that, for people who don't know about this, is that the olden people in olden days used to think that the uterus is a weird organ that just,
walks around the body.
Gets wanderlust every now and then. It's like, आज हम दिमाग में जाएंगे, and that's why women get headaches. आज हम दिल में जाएंगे, that's why women get anxiety. So,
everything was blamed on the uterus.
Everything was blamed on the uterus. And it's so important that we talk about language and the role of language in healthcare and medicine, because while doing research for my book, I learned that the word vagina, it means a sheath, which means it's just a vessel to hold the mighty sword of the penis. We're given such a passive role even in something in our language, it's so pervasive.
And I mean, forgive my language, but pussy is an insult, right?
Yeah.
And to have balls is like a show of strength, where
balls are really sensitive.
And a vagina can push out a 3.5 kg baby and be absolutely fine.
Yeah.
I mean, they can take a pounding, they can take a beating. And I'm not only talking about, I'm talking about delivering a baby.
Actually, since we're talking about delivering a baby, let's talk a little bit about how people do get pregnant, because I feel like there's so many questions about how to get pregnant, how not to get pregnant. How does a pregnancy work?
So during your menstrual cycle, during any woman's menstrual cycle, at around the 14th day, if you have a 28-day cycle, or if you count backwards 14 days from the first day of your period, that's the day you ovulate. So the day you ovulate is when your egg is released, and then it waits around for about 24 to 48 hours for a sperm to come in.
Waiting for Prince Charming.
And so if the sperm comes along about 5 days before you ovulate, or 1 or 2 days after you ovulate, that's when a pregnancy happens. So that's how it happens usually.
And what can people do to make sure this doesn't happen if they want it? And what can they do to make sure it does happen if they want it?
So if you do want a pregnancy to happen, first of all, you need to know when you ovulate. So this depends on how long or short your cycle is. So the thing is, not everybody's cycle is exactly the same. Mm-hmm. So you need to know how your cycle is. But you remember that ovulation always happens exactly 14 days before the day you start menstruating.
Okay, so can you break it down for me? That's a little complicated. So let's say today is, I don't know, the first date of the month, and let's hypothetically say this is March. Today is the 1st of March, which means February has 28 days. So how do I calculate this?
So if today is the 1st of March, mm-hmm. then and your period comes today, mm-hmm. that means you've ovulated exactly 14 days ago.
Okay.
So that would be the 14th of February.
Ooh.
Wow. Yeah.
That's
why so many babies are born on Children's Day. I mean, that's a running joke between obstetricians everywhere, but yeah.
You see why I chose that date. So, when people do get pregnant, there is so many pieces of advice, mostly useless pieces of advice that are thrown at people. कि ये नहीं खाना, वो नहीं खाना, यहाँ नहीं जाना, ये नहीं करना, नहाना नहीं है, इतने बजे से इतने बजे के बीच में, सर पे इस एंगल से पानी नहीं पड़ना चाहिए, धूप इस एंगल से तुम्हारे मुंह पे नहीं पड़नी चाहिए.
I wish people would realize that pregnancy is a completely natural thing, and it's just like a physiological phenomena. It's not a freaking disease.
Thank you.
You don't need to lay in bed, be careful, or unless you have a complication, of course. So most pregnancies, you can just be yourself, just do what you would normally do. Of course, there are certain things that you don't eat, which are like green papaya, which can cause uterine contractions. But then now it's suddenly applied to papaya everywhere, and
sushi. We love to eat sushi.
Yeah, so certain fish you need to avoid in pregnancy because they're high in mercury content, and you don't want to be eating anything raw and getting sick, Also raw eggs.
Yeah.
You can have salmonella in them. One thing people don't realize is mayonnaise. Mayonnaise is made from raw eggs. Sunny side up as well,
Oh, yeah.
Yeah, because it's raw, so...
And actually, that makes me think about food cravings, because food cravings are so weird. So many times that's the first sign people I mean, if your cycles are irregular.
And
so
food aversions.
Oh, yeah.
Yeah, suddenly I couldn't eat pork anymore, and I'm a Goan. I'm like, okay, this is definitely my husband's child because he's from Karnataka and he hates pork. So I'm like, this is weird. This is just very weird.
And like, why do cravings happen?
I think the body recognizes that it lacks in certain nutrients maybe sometimes, and that's why you have these strong food cravings. There's also something called pica that you might have heard of, that when you're deficient in certain things like iron, then you have these cravings for these weird things like
when you like to eat the walls,
ice,
quite literally.
Also, yeah.
Yeah, ice.
Yeah. So it's just your body's way of kind of telling you that, you need certain things.
So people who like to eat walls, we say that, and I'm not saying this as an exaggeration. Some people literally want to eat the wall
Yes,
because they're deficient in calcium.
Yeah.
For a lot of people, especially those who have irregular cycles, the first sign of them knowing that they have a pregnancy is, weird food cravings or things like that, especially how it was shown in the TV. Arey, achar chahiye, arey, khushkhabri aayi hai.
This happened to me at my brother-in-law's wedding. I'm like quietly roaming around 2 months pregnant, very smug that nobody knows. And then I pick up a piece of pickle and everyone just turns and looks at me and goes, aha, there's something you're not telling us. I'm like, damn it. True story.
Bhanda 4. So it's so funny. When did you take that pregnancy test? How did you know? How early did you know?
People hate me because I've never vomited once in my 3 pregnancies. I've never had nausea, ever. So I had a breeze my first trimesters. But I was walking around during rounds and I suddenly had to sit down. Like I had a little bout of giddiness and I'm like, oh crap. Pregnancy test, please. So that's how I knew, yeah.
But when is the right, I mean, you as a gynecologist, of course, that's the first thing in your mind. But when should people who are not gynecologists, how do they know? When is the right time to take a pregnancy test?
So I think everybody should keep track of their cycles. I think this is something you should tell all of your daughters. Just maintain a menstrual calendar. Nowadays you get these wonderful apps, you know, you don't even have to write it down in a diary like we used to tell our patients to do in the past. And you should know when your cycle is coming. You should know what your cycle is. You should know how your body behaves. So if you go over your cycle about a week, I think that's a good time to do a pregnancy test, because pregnancy tests are based on a hormone called beta HCG, which is detected in the urine. So if you try to do a test too early, then the levels may be low and you might think that you're not pregnant when you really are. And, you know, so it's just better to wait that 1 week so that, you know, it's more for certain.
It's so interesting that you mentioned the beta HCG thing, because in the olden days, people used to do the weirdest things to find out they're pregnant, including peeing on frogs, because then the frogs would make eggs, and then, you know, you could pee on a certain frog and keep it in the lab and see, isme anda ban raha hai ki nahi anda ban raha hai, that means that person is pregnant. Or even peeing on...
Picturing somebody peeing on a frog.
Hello, here's your pregnancy test. Ribbit. Or even like peeing on barley or rye, because then they would sprout or something like that. It sounds really stupid to us right now because it sounds like one of those...
We live in a wonderful time. People don't realize this. We live in an amazing time.
People like to romanticize the past. But in the past, there was no access to contraception. There was no access to dental care. There was no access to chashme.
There was no access to period products. You had to sit and fold cloth and then wash it all the time. I mean, can you imagine what our grandmothers went through?
It's very interesting because there's some very cool data on how the birth of feminism coincided with the invention of the washing machine. Because इससे पहले औरतों के पास time नहीं था to care about feminism, क्योंकि कपड़ा धोने में इतना दिन लगता था.
You know? That's interesting.
And also along a similar line, we also do need to talk about contraception and how cool it is, because there is so much data to show that after the invention of contraception, more and more women were able to take charge of their life and get more educated and get into the workforce. And world development is linked to the advent of contraception. And
for sure, yeah.
It's just so incredible that barely 50 साल पहले कुछ नहीं था हमारे पास. Itna reliable.
You have so many options. The only
so
beef
cool
with it is that you don't have any male options. But yeah.
I'm actually covering a lot of this in my book, where we're talking about how it's been difficult to create male contraceptives because
men don't get pregnant. Also, there's not much research into it because they don't have the burden of the pregnancy as such.
Very important point. But also, there is so much sperm. So much. As we're speaking, every second somebody makes 1,500 sperm. In the while that I've said this sentence, people who are listening to this may have made 10,000 sperm.
That's a beautiful mental picture. Thank you so much for that.
I duly apologize. But, since we are talking about contraception for men, condoms are wonderful and condoms are so cool. And
condoms get a bad rep, but most of the failure of condoms, as a contraceptive and for STDs, is because people are using them wrong.
How can you use a condom wrong? इतना छोटा सा तो है, सिर्फ चिपकाना है, रेनकोट ही तो है, क्या करना है?
First of all, don't buy an expired condom or don't keep a condom in your wallet like forever.
That's so important because, up until I started reading about all of this, I didn't even know condoms expire. उसमें कौन सा खाना खराब हो रहा है?
Yeah, because you could get these little tiny holes in them, and remember that sperm are like very, very, very tiny and they're microscopic and they don't need much to get away,
Yeah.
So another thing is 2 is not better than 1. Do not use 2 condoms. Okay, it is not going to help. It's going to make things worse. Also, don't, start, stop, use the condom, get to the point of finishing, take the condom off, go again. Because there's pre-cum that has sperm in it. And after you come and then you take off the condom, there may be sperm on the penis and then you can get pregnant in that way. So that's another point.
And
also pinch the top before rolling it down, because then that little air bubble remains, and then during thrusting that could cause the condom to rupture, and then that could also cause a pregnancy.
See, there's so many ways, there's so many things, these little things nobody tells you about how to get pregnant or how not to get pregnant. And what rubs me the really wrong way is that we have so much good science and so much good evidence to, say all of these things, and very simple things, yaar, matlab pinch karke pehen lo, or, just buy a new condom.
Take it off when the penis is still erect.
Yeah. There's such simple things one can do, and yet nobody tells us. But you know what people do tell you? They'll tell you thing like, especially when I see Instagram, sometimes I'm just like, kya bakwas kar rahe hain ye log? There'll be such weird nonsense about, this is how you should not get pregnant, and if you if you eat this thing and then have sex immediately after, you will not get pregnant, and that it doesn't work like that. It's so infuriating.
Yeah.
What's your favorite Instagram piece of bullshit information?
Oh, vaginal steaming, for sure. I hate it. Oh my God. It's just a full pet peeve of mine.
What is vaginal steaming?
So vaginal steaming is a concept that is rooted in patriarchy, first of all. People don't realize this. So it's marketed as a very feminine goddess kind of thing, which is actually the complete opposite. It's not women empowerment. It's basically where women take off their underpants and they sit over a kind of bowl that lets off steam, with some herbs and stuff in it. And it's supposed to be very good for your vaginal flora and your vaginal health and blah, blah, blah.
Detoxifies your dirty womb.
But you have to remember that this was all started in postpartum women as an attempt to tighten their vagina so that they could have better sex with their husbands. This is how all of this started. And second of all, your vagina is badass and it kind of cleans itself, and it does not need you or a bowl of steam or a very expensive spa to clean it for you. Also, it could harm you, right? I mean, you could get burns. You could actually lose those healthy bacteria that live in your vagina and get an infection with vaginal steaming. So that's one thing that really grates me.
Yeah, I really want to go up to these people and be like, "Gyan mat pelo yaar, this is not true."
And this is huge celebrities that are endorsing this. It's irresponsible.
It is so irresponsible, and there's so much subliminal messaging about detoxifying or cleaning the vagina, like yoni pearls and yoni steaming and all of these things, and they take these things from Eastern cultures and co-opt it and bastardize it, and there's so many things that are wrong with it. It is a fetishization of different cultures. It is of course super patriarchal and misogynist, and so many things wrong with it. I'm so glad you brought this up. It's the responsibility of people who are making this sort of content that is, they have to be more careful about what they're saying, and they have to make sure it's rooted in science.
And these celebrities are usually selling something along with this concept. So they're making money off of these people whom they're conning. So
it's always a product or a program or a join my whatever mailing list or all of those things.
I mean, you're fixing something that's not broken.
Yeah. Oh, yeah. So important. How did you end up on social media? How did that come about?
So like I said, my whole experience being gaslit when I was pregnant, and I realized if that could happen to me, who's a freaking gynecologist, if I could
And who comes from a family of gynecologists.
Yeah, if I could believe that my pain was not real, what is going to happen to other people, who don't have certain knowledge of basic medical science, who will believe a doctor, who will say, okay, if you say so. But no, I think you need to advocate for yourself. And I wish I had done that. I wish I had just kind of stood up for myself and advocated for myself and said, you have to believe me. This is what I'm feeling, and I'm not going to stop advocating for myself until you get to the bottom of this, because that's your job as my doctor.
I love it. This has been one of my favorite conversations so far. Thank you so much for joining me.
Thank you so much for having me.
I love angry women, and angry women are going to change the world.
Yes, for sure.
Thank you.